Regina Herzlinger, if we have this right to health care, are there any limits on that right? Or is it entirely open-ended? Or how would we decide what is an appropriate level of health care to provide to the entire population?
Well, I think that is a political decision. It's a very good question. It's a decision that society as a whole must make about how much we're willing to devote to health care. But in a consumer-driven healthcare system, people decide for themselves how much they're going to spend. They have to buy health insurance, but they decide for themselves whether they're going to buy a soup-to-nuts kind of health insurance policy or something that's more limited. So I think there are two things that are being confused here. One is, do we want to have a system where poor people and sick people are covered? Another issue is, do we want the system run by the federal and state governments? The reason I talked about Switzerland is it achieves the best of both worlds. It covers everybody, and yet it does so through the private sector. The Swiss healthcare costs are 40% less than ours. 40% in the United States would mean $800 billion that we could spend on other goods or services or for reducing taxes or the deficit. Huge sum of money.